Okay, this is the second lecture for this week. This is the lecture for the 26th. We're starting on chapter 7 today. And chapter 7 is about other addictions and other drugs. Other than the uppers, downers, and all arounders, there are other addictions out there, and there are other drugs. Inhalants, we haven't really talked about inhalants. You can inhale volatile liquids, you can inhale aerosol sprays, you can inhale gases that come in pressurized tanks, uh, and those substances have many of the same psychoactive effects of the street drugs. And of course, that's one of the reasons why people inhale them. We're also going to talk about sports drugs. There's three different types of sports drugs that we're going to be looking at. We're going to look at drugs that accelerate the healing of injuries. We're going to look at drugs that increase performance, and drugs that alter the state of the athlete's consciousness. And of course, that's mostly the street drugs that we have been talking about up to this point. We're going to talk about hard to classify drugs, animal extracts, herbal preparations, smart drugs, and drinks, and nootropics. Nootropics have been used for their psychoactive effects. They have been used to improve mental health, and they have been used to improve physical health. And so we're going to look at all of that as well eventually. This is a very large chapter, but I think we can get through it okay. Inhalants are used, not today, of course. Inhalants are used because the user finds it stupefying, they find it intoxicating, and from time to time they find it psychedelic. There are three main types of inhalants. There are the volatile solvents and aerosols. There's volatile nitrites, and nitrites are really kind of interesting. This has to do with sex, so well, anyway, when we get to it, we'll talk about it. And we're going to talk about anesthetics. Most of the volatile solvents and aerosols are synthesized from petroleum and mixed with other chemicals. Hydrocarbons are found in glues and gasoline and nail polish remover. Many aerosols are inhaled for their propellants rather than their ascribed contents. Other volatile organic compounds include esters, ketones, alcohols, and glycols. The volatile nitrites include butyl and amyl nitrites. These drugs are used as vasodilators for people with heart problems. They have also been used in air fresheners. Illicitly, they are used recreationally at parties, but especially in sexual situations. These are the drugs called poppers. Um, I had no clue about this until I read about it. It's really kind of fascinating. Anesthetics are used to block pain or induce unconsciousness for medical procedures. Nitrous oxide is used in dentistry for anxious patients who do not wish to use Novocaine. When I was in the service, I had a lab officer who hated the feeling of Novocaine because he said it numbed his cheek and it made him look funny. So he would have all of his dental work done without any Novocaine, and I thought that was the dumbest thing I'd ever heard. But I found him to be one of the dumbest guys I've ever met, so it wasn't that big a deal. He couldn't cross-match blood, which is, well, we won't go into that. Nitrous oxide is also known as laughing gas. It is not uncommonly used at parties to induce giddiness and euphoria, if they can find it, of course. It's not really out there for common usage. It's not like you can go to the store and buy nitrous oxide to have a party. The most widely used inhalants are nitrous oxide, nitrites, gasoline, glue, spray paint, aerosol sprays, lacquer thinner, and correction fluid, as weird as that seems. And this is one of the reasons. In the old days, you used to be able to buy correction fluid in 12 container boxes, but these days you can't do that anymore. You can only buy them one at a time, as odd as that may seem. Inhalants are sought because they are quick acting with intense effects. They enter the bloodstream very rapidly, 7 to 10 seconds, and they may last for a few minutes to an hour. They are cheap, readily available, and widespread. There are more than 1,500 chemical products that can be inhaled for their psychoactive effects. They are readily accessible to children and adolescents, as many exist in anybody's garage at their home. They have more direct toxic effects on body tissue, and this is really kind of the sad thing about inhalants is the fact that they are so destructive. There is a lack of awareness of inhalants as drug problems, of course, and this is because it's mainly our children that are doing it, and we overlook what our children are doing, especially if they're being bad. Inhalant abuse is most prevalent among adolescents. Inhalants account for from 700 to 1,200 deaths in the United States per year. This is a worldwide problem as cheap highs are sought by the young, the poor, the street children, recent migrants to cities, indigenous peoples, and children of parents who work at home with volatile chemicals. The inhalant of choice in many poor countries is gasoline because it's available. And it's, of course, some gasoline has lead in it, which is dangerous, and this kills more people than any other inhalant drugs. Inhalants are most likely abused by 12 to 17-year-olds and more females than males, oddly enough. Mostly nail polish remover, nail polish itself. Um, anyway, they're huffers. This problem was especially serious in the 1990s, but has since dissipated, not nearly as bad as it was in the 1990s, when they were trying to find a replacement for marijuana. American Indian and white adolescents are more likely to use inhalants than blacks or Asians. There are 7 methods of using sniffing, breathing the inhalant through the nose directly from the container. That's what you would do with nail polish. Huffing, soaking the material and putting the material over the mouth and nose. And of course, that causes an interesting rash. Bagging, soaking material and placing the material in a bag to be inhaled through the nose or the mouth. Spraying the inhalant directly into the nose or the mouth. Balloons and crackers, puncturing a can of inhalant and capturing it in a balloon for inhaling. Masking is where you spray the aerosol in a bag and then put the bag over your head. And then just spraying on your clothing. When I was working in the hospital in Omaha in the 1980s, we could always tell when the kids had been doing any of this stuff. Because when they came in, of course, they were usually unconscious and they couldn't talk, or even if they were conscious, they still wouldn't talk. You could smell it on their clothes. It was fairly obvious. I mean, nobody has these odors following them around. They're fairly strident odors, and of course, we were able to identify it from just the smell. Now, the problem is, of course, a lot of medical professionals don't like to smell things. They don't want to. They don't want to acknowledge that they can identify things through odors. But of course, as a laboratory technician and not spending that much time with the patients, if I went into a room to draw somebody's blood, then I was always aware of what the smell was, even if even if the nurses had ignored it. Once upon a time, I think I've told you this story. Once upon a time, I went into a room and there was a 7-year-old who had he was 7 or 8 years old. He was unconscious, and the nurses weren't exactly sure what was going on. They said that the father was drunk, and they thought that he had done something to the child. So I went in to draw the kid's blood, and while I was over there, I smelled alcohol on the child, as if he'd been drinking something stronger than beer. It was just a really strong alcohol smell. And so when I went out and talked to the nurses about it, they said, no, that was the father. You're smelling the father. I said, no, that's not it at all. I was over by the father, and he does smell like alcohol, but it's not this as strong as it is with the kid. Uh, and so finally, of course, they went in and I've started sniffing around, and they realized that that's what had happened. The kid had too much alcohol to drink and had passed out at 7 years old. The father had no idea. I mean, otherwise he would have told us what was going on. And they were ready to throw the book at him, but of course that's not what had happened. The kid had snuck around and had gotten into his father's alcohol. And despite the fact that the father had had a couple beers, it was a stronger alcohol smell. So this is a really odd, especially now that we're talking about the coronavirus. I guess we're over 500 deaths today. We've passed the 500 mark. Wow. Volatile solvents are carbon and hydrocarbon based compounds that turn to gas at room temperature. Gasoline, gasoline additives, paints, especially metallic paints, kerosene, air dusters, paint thinners, lacquers, nail polish remover, spot removers, glues, and plastic cements, and lighter fluid. These are all hydrocarbons, carbon and hydrocarbon compounds, and they have some fairly strong odors. Volatile solvents are absorbed very rapidly in the blood and move to the heart, brain, and the liver within 7 to 10 seconds. So if there's damage to be done to the liver, this is going to take place very, very rapidly. If there's going to be brain damage, then it's going to happen very, very rapidly. Temporary stimulation, elevated mood, it causes reduced inhibitions, impulsiveness, excitement, irritability, dizziness, slurred speech, unsteady gait, and drowsiness. These inhalants are exhaled by the lungs and excreted by the kidneys. And this is one of the reasons why we would be able to detect this when an individual had a problem because we could smell it on their breath, and also it was in their urine. And I guess I talked earlier about smelling people's urine or looking at their urine or whatever. We were talking about beta carotene in health class, in health psychology, and I was talking about urine. And I've worked in urinalysis, so I've seen millions of containers of urine, and you can actually smell it. You can smell a lot of strange things in urine. You can usually detect what the individual has been doing and what the individual has been eating. After prolonged inhalation, the user may experience delirium with confusion, psychomotor clumsiness, emotional instability, impaired thinking, and possibly they will go into a coma. Long-term effects of inhalant use, arrhythmias and myocarditis. Remember, it goes directly to your heart, your brain, and your liver, so it can cause heart damage. Pulmonary hypertension, respiratory distress, and lowered breathing capacity. It can damage your lungs, and of course, this is something we don't know about the coronavirus. People are coming down with this, and we don't know how much damage it's doing to their lungs. Liver toxicity, because it has to clear this toxin out of the human body. Carboxyhemoglobin may cause brain damage. Carboxyhemoglobin has to do with oxygen being replaced by a monoxide, by a single. The oxygen that we breathe, the oxygen that we utilize, we're able to utilize it because it is O2. But if it only has one molecule of oxygen, then it has a greater affinity for hemoglobin. And if it does, of course, it's not the stuff that can help you survive. Carbon monoxide is what we're talking about here. And it's only one molecule of oxygen. It has a greater affinity for hemoglobin than O2 does. And for that reason, it replaces the it destroys the red cell that carries it. And of course, if these red cells get to the brain, it doesn't, there isn't enough oxygen, there's not enough O2, and the individual will, there can be brain damage or death. And that's what happens with carbon monoxide poisoning. Some inhalants may cause neonatal growth retardation, odd facial features and tremors in newborns. This is really a tragedy if mom is dumb enough to use an inhalant during pregnancy, or if she gets into a situation where she's breathing paint fumes or she's breathing lacquer fumes or whatever. This is really something that mothers need to be aware of. They need to stay away from these kinds of things. While most huffers move on to other drugs, those who stay with inhalants can expect some fairly debilitating effects. If they inhale this stuff for an extended length of time, they've got a really serious problem because this stuff is extremely toxic. Your body can repair itself to some extent, but if you do this for an extended length of time, there is permanent damage that is done. And of course, if that happens, then now we've got a really serious problem. Poor coordination characteristics, inability to concentrate, weakness, disorientation, weight loss, something that's very obvious. And this is, of course, something that you should be watching in your own children. If they have this severe weight loss, then it may mean that they've been inhaling something. Memory loss due to hippocampal interference, poor problem-solving skills, difficulty controlling one's behavior, blood irregularities, which usually include anemia, and potentially chromosomal damage, which means that they won't be able to reproduce. Chronic huffers tend to have antisocial personality disorder, but it is not sure whether the huffing causes the behavior or the environment that these individuals come from cause the antisocial personality disorder problems. These individuals also tend to use whatever drugs they come across. The most widely abused substance is toluene. It's another name for methylbenzene because it is such a good accelerant and is in so many products. This is once upon a time they used to talk about sniffing glue, and the reason the glue was the reason that the glue was an intoxicant was because of the toluene in the glue. Now they've taken the toluene out of glue. I'm not really, it smells like orange peels now. And that has the plastic glue I'm talking about. So little boys back in the 60s and 70s potentially were putting models together and they were getting high while they were doing it, if they did it in a closed room with airplane glue, what they call airplane glue. It's plastic glue. Drying agents have toluene in it, solvents, thinners, paints, inks, cleaning agents have toluene. 65% of the chronic abusers of toluene have neurological damage, and this is what I was talking about before. If you're a huffer for any long period of time, now we've got a problem because it causes neurological damage. Trichloroethylene, TCE, is another common solvent found in substances used for huffing. Correction fluid, this is why you can't buy more than one container of correction fluid. Paints, metal degreasers, spot removers, extracting oils and fats from vegetables. I had an uncle who was owned a dry cleaners, and he had all of these solvents in the back of his shop, which was kind of interesting. He could take just about any stain out of any clothing. It was really kind of interesting. It causes depression and it moderates hallucinations. And moderate hallucinations, if used heavily, it can cause neuropathy. Some of these neuropathies can be permanent, of course, from the TCE. In hexane and methylbutyl ketone, or MBK, are solvents used for glues, there's solvents used for adhesives, diluents for plastics, diluents for rubber, in the production of laminated products, as a paint thinner, as a solvent for dyes. N-hexane and MBK have been shown to cause neurological damage, especially in the brain. Recovery can take up to 3 years for recovery. Small molecule alkanes are gaseous at room temperature and cause cardiac arrhythmias and sudden death, and include methane, ethane, butane, and propane. Large molecule alkanes are also neurotoxic and include hexane and pentane. When I was living in Montana, the there's a group up there of Anabaptists. Anabaptists are like Amish or Mennonites or Moravians. There was a group up there called the Hutterites, and the Hutterites lived in colonies. One family would live, or one named group would live on a colony, and each colony produced a certain food commodity. Some of them grew corn, some of them grew wheat, and they would make corn meal out of their corn. They would make flour out of their wheat. Some grew chickens, some grew beef, and some grew pigs. The one that grew pigs was over by Havre, just north of Havre. And they would scrape the pig manure into a big cement enclosure that was down. They dug an enclosure, and they covered it with cement, and then they would scrape the manure down into this enclosure. One day, an individual fell down into the manure while he lost his balance and fell into the manure. His wife bent over to grab his arm and pull him out. Unfortunately, pig manure creates methane, and the methane is almost instantaneously fatal if you breathe it. And he was dead before he hit the manure. And when she bent over and stuck her head down into the cement enclosure, of course, she breathed the methane, and she died almost instantly as well. So it was a real tragedy, and they talked about it for years, about pig manure killing these two individuals from the Hutterite colony north of Havre. Okay. Gasoline is readily available and used as an inhalant, especially on American Indian reservations. Now, when I say the American Indian reservations, actually what I'm talking about is First Nation reserves in Canada. They have this problem. I've lived up north, and I've lived here, of course. I've lived in the Southwest. I haven't really seen this, but evidently it's prevalent up on the reserves up in Canada. The effect of gasoline, if you huff it, it only lasts for 3 to 5 minutes. Not only are the hydrocarbons neurotoxic, but the solvents, metals, and additives can cause problems as well. It can cause insomnia. It can cause tremors, anorexia, paralysis, lead poisoning, brain, liver, and bone marrow problems, as well as kidney and lung damage. A residual effect might last from 5 to 6 hours. Over half of all inhalant deaths are due to gasoline inhaling, as sad as that is. Alcohols are the most frequently abused inhalant solvents. We're not really talking about the alcohol that you can drink. We're talking about methanol and isopropanol mostly, but also ethanol. You can huff it if you want. You can snort it. When inhaled, alcohols can produce a mild high, along with nausea, vertigo, weakness, vomiting, headaches, and abdominal cramps. For ER personnel, it is important to know the warning signs of solvent abuse, and I've seen this over and over and over again. Um, it's really kind of tragic, but of course you can usually tell what the individual has been snorting. Actually, you can smell it on them, and you can usually tell what's going on. They usually come in with headaches. They do have a chemical odor in their breath and on their clothes. They have red, glassy, or watery eyes with dilated pupils. They tend to have nosebleeds because sometimes it's a vasoconstrictor, sometimes it's a vasodilator. They have inflamed noses, so the mucous membrane inside the nostril tends to be red and puffy. They may have a rash around their nose and mouth because of the toxicity of what they've been inhaling. Their speech tends to be slow, thick, or slurred. They don't walk very well, and usually they are helped in, or sometimes they are come in on the wheelchair. So their gait is staggering, disoriented, and they lack coordination. Pain. They tend to have pains in their chest and stomach. They're suffering from fatigue. They complain of nausea, shortness of breath, loss of appetite. They're obviously intoxicated. The problem is a lot of these kids are aggressive, and they're fighting the person bringing them in, and they're fighting the individual that's trying to help them, which is never a lot of fun. I've broken off needles in people's arms who had been inhaling something, and of course they threatened me. I've been threatened a lot. They tend to have, from time to time, they'll have seizures, and sometimes they'll be in comas. Nitrites have been used as medicines, especially heart stimulators, for angina since the 19th century. There are several different types of volatile nitrites: alkyl nitrite, isomyl nitrite, butyl nitrite, isobutyl nitrite, isopropyl nitrite, and cyclohexyl nitrite are the different types. Nitrites dilate blood vessels so that organs can receive more blood. This is usually done for the heart during angina attacks or with cyanide poisoning. Of course, we see a lot more angina than we see cyanide poisoning, thank goodness. It takes 7 to 10 minutes for the effects to take place and lasts for 60 to 70 seconds. 7 to 10 seconds for the effects to take place and lasts for 60 to 70 seconds. The blood pressure lowers and hits its apogee at 30 seconds and returns to normal at 90 seconds. So all of these poppers that we're talking about, this only lasts for about 30 to 90 seconds. We're going to start talking about sex in just a second, so bear with me for a second. Nitrites are sometimes called poppers. I thought poppers were in tubes like nitrous oxide, but I'm wrong. They're just in bottles, and you uncap them and you snort what's in there, and that's what a popper is. Nitrites cause a feeling of fullness in the head. It gives you a head rush, mild euphoria, dizziness, and giddiness. As the inhalant burns off, they might experience headaches, nausea, vomiting, and chills. Okay, so we're talking about snorting all this stuff. We're taking it into our nostrils, and then we're having all of these effects. Excessive abuse may cause oxygen deprivation because you're replacing O2 with nitrites, and of course that's not a good thing. Fainting or passing out, temporary asphyxiation because you're not breathing oxygen, you're breathing the nitrite. Overdoses do occur and necessitate taking the victim away from the nitrite. That's all you have to do is take them away from the nitrite. CPR might be necessary to maintain heart rhythm and respiration. Chronic users will have a reduced oxygen carrying capacity due to methahemoglobinemia. That is the monoxide, the single molecule of oxygen replacing the O2. Nitrites are used to enhance sexual activity by increasing blood flow to sexual parts and relaxation of smooth muscles. So a lot of individuals that are having problems with sex will use poppers. This is especially necessary when the anal sphincter requires relaxation during anal intercourse. Now remember, we were talking about the 30 to 90 seconds before. So one of the things that happens is, sorry about that, my cat just stepped on my laptop. We're talking about anal intercourse, and this is how it doesn't make any sense to force a penis, which is relatively large, into an anus, which is closed off. So what they will do is they'll use these poppers. It will allow the anal sphincter to relax, and that is when they have anal penetration. That's when they can achieve anal penetration. Of course, it only lasts for 90 seconds, and then after the 90 seconds is over with, the sphincter tries to close, and of course at that stage they're having intercourse, they're having anal intercourse. Unfortunately, nitrites impair the immune system by inhibiting the functioning of white cells. Nitrites also convert to nitrosamines, which are cancer-causing chemicals. So if you do this too many times, potentially you're going to develop cancer or whatever, hemorrhoids. My goodness gracious, who knows? Okay, so if we mix remember poppers lower your blood pressure, and so if we mix it with Viagra, which also lowers blood pressure, now we got a really serious problem. We've got an individual that potentially could die. So if a man is using Viagra and poppers, it might kill him. When these two drugs are used with methamphetamines, people have been known to faint or even die. They're overstimulating the heart. They're overstimulating the heart. Volatile nitrite abusers are notorious for multiple drug use. This is very common in the LGBTQ community, especially the gay community, the male homosexual community. 2/3 use at least 3 other inhalants. 1/3 abuse alcohol. 1/3 abuse drugs other than inhalants. Anesthetics are used, so we're done talking about nitrites. No more talking about anal intercourse. Anesthetics are used to slow the CNS, the central nervous system, and stop pain from reaching the brain. Anesthetics also cause euphoric effects when abused. One of the first anesthetics to be abused was nitrous oxide, of course. Recently, nitrous oxide has been abused along with ecstasy to accelerate the rush and to enhance the effects of whatever's going on. Nitrous oxide is sold in small plastic canisters to be used in cooking. Nitrous oxide's effects include dizziness, giddiness, and disorientation, silly laughter, buzzing and throbbing in the ears, visual hallucinations, confusion and headache, feeling that one is about to pass out, impaired motor skills, and fainting. The effects only last 2 to 3 minutes. Cognitive functioning is impaired with the drug, but returns to normal after 5 minutes. Long-term exposure can cause peripheral and central nerve cell damage due to lack of oxygen. Once again, we're replacing the O2 with, in this case, it's nitrous oxide, and nitrous oxide is a single oxygen molecule. Nitrous oxide replaces oxygen in the blood, as I just said. Long-term exposure will lead to loss of balance, loss of dexterity, overall weakness, numbness in the arms and the legs, cardiac arrhythmias, asphyxia, seizures, and potentially death, of course. But that's only if you Don't if you use it too much. Halothane is rarely used in the West. It is widely used in the third world countries because it is inexpensive and it works very rapidly. This anesthetic is used primarily in veterinary procedures. It is most frequently abused by hospital personnel, and it's known as halothane. I've never seen this stuff, but then again, I've never really practiced any medicine in third world countries. Inhalants cause less physical and psychological dependence than other depressants. Inhalants cause cognitive impairments that hinder comprehension and recovery. Inhalants will sometimes cause a cross tolerance to other depressants, especially alcohol if used chronically. Inhalants are seen as low class among the drug using community because it is for poor people or for poor kids. Three categories of drugs that are used in sports: therapeutic drugs used for specific medical problems and administered through proper medical supervision, ergogenic drugs, which are performance enhancing drugs, and then recreational and mood altering drugs. Therapeutic drugs include analgesics, muscle relaxants, anti inflammatories, and asthma medication. Ergogenic drugs Ergogenic drugs include steroids, human growth hormone, blood doping, and stimulants. Let me let the cat out. What? My goodness. Here, just go outside. Sorry about that. Athletes use drugs because they perceive drugs as a quick way to put on pounds and muscle, increase stamina, get up for a game, to relieve pain, and to keep up with other athletes who use drugs. This is what was happening during the steroid era in baseball. We had all of these home run hitters. We had all these home run hitters that were cranking the ball out of the ballpark. Mark McGwire, Sammy Sosa, Barry Bonds. These guys were hitting 70 home runs a year. The pitchers, in order for them to pitch against such amazing athletes, they had to use steroids as well. One of the things we do know about baseball is that most of the people that are caught using steroids are pitchers. So why in the world would a pitcher use steroids? Why does he need bigger muscles? What he's trying to do is increase his pitching speed. And of course, this has been, we have been talking about this in the 21st century because of what happened in the late 1990s with Sammy Sosa, Mark McGwire, and Barry Bonds. They broke all kinds of amazing. They hit so many home runs, and of course the pitchers had to stay up with them. But the pitchers are still using steroids, so don't feel sorry for the pitchers because people are hitting home runs off of them. Don't cast aspersions just at the home run hitters. Roger Clemens, of course, used steroids all of his career, as did A-Rod, Alex Rodriguez. Analgesics, sorry about that. Analgesics and anesthetics are used to deaden pain and include both topical anesthetics and oral anesthetics. The topical anesthetics are the alcohols, ethanol and methanol, procaine and lidocaine. These are what you would put on your skin in order to deaden the pain. The oral analgesics include aspirin, ibuprofen, acetaminophen, hydrocodone, Vicodin, which is another name for Vicodin, meperidine, which is another name for Demerol, morphine, codeine, and propoxyphene, which is another name for Darvon. Ibuprofen, Tylenol, is Advil is ibuprofen. Acetaminophen, another name for it is Tylenol. And of course, aspirin doesn't have any other name. The biggest problem with analgesics, well, aspirin does, acetylsalicylic acid is what aspirin is. The biggest problem with analgesics and anesthetics is that they take away the pain without repairing the damage. Of course, the damage isn't repaired, but it is, a lot of times it's reducing the swelling, and sometimes that can be, the swelling can be the damage. And so once it reduces the swelling, then the pain goes away, as exciting as that is. Muscle relaxants are drugs that depress the neural activity within skeletal muscles and are used to treat muscle strains, ligament strains, muscle spasms, tremors, or shaking. You have Soma and Vanadom, you have Robaxin, the benzodiazepines, diazepam, clonazepam, and chlordiazepoxide. That's Valium, Klonopin, and Librium. When I was in the service during Vietnam, we handed out Valium and Librium very liberally. What we were trying to do is we weren't trying to take the pain away. We were trying to take the anxiety away from military wives whose husbands were overseas and in combat, and there was a lot of that going on. So we were handing out lots of Valium and Librium. Anti-inflammatory drugs lessen pain as well as control inflammation. These drugs come in two different classes: non-steroidal anti-inflammatory drugs, or NSAIDs. That's the aspirin, ibuprofen, indocin, butazolidine, Clineural, and Celebrex. Celebrex is actually only for rheumatoid arthritis. And then we have the corticosteroids, the prednisone and cortisol. I was playing softball at Reese Air Force Base, and we were playing for the base championship. And I had a knee problem. My knee was getting sore, and so the shortstop was the surgeon, and the surgeon decided that he needed me to play. I was one of the stars on the team. He wanted me to play very, very badly, so he gave me a injection of prednisone in my knee to take the pain away. Of course, I don't know if you've ever had a prednisone shot, but it hurts like the devil. It's supposed to take the pain away, but it hurts when it happens. And I passed out. I was laying on the surgeon's table, and he gave me that shot, and I passed out. It was so painful. I went ahead and I did play the game. I was going to play the game anyway, even with a bad knee. But that's the last prednisone shot I've ever gotten. I don't think I'll ever do that again. Both types of anti-inflammatories have their problems. NSAIDs, aspirin and ibuprofen cause ulcers and kidney problems. I have had my kidneys have shut down before. When I was a senior in college and running track, my kidneys shut down. And I've had kidney stones. So I try to stay away from aspirin and ibuprofen. Celebrex is only recommended for arthritis, as I said before, and may cause heart and gastrointestinal problems. Corticosteroids could cause water retention, bone thinning, muscle and tendon weakness, delayed skin healing, vertigo, headaches, glaucoma, psychosis at high doses. So we have to stay away from corticosteroids. Asthma medications open air passages. 10% of the general population has asthma. That's 1 out of every 10 people, if you count off, they have asthma. Asthma is often aggravated by heavy exercise and stress. Exercise-induced asthma occurs in 11 to 23% of athletes. They have exercise-induced asthma, and they are athletes, which doesn't make a whole lot of sense, does it? Most asthma medications used by athletes are beta-2 agonists. Clenbuterol, which you can't use if you are an athlete, and albuterol. Albuterol is usually what you use, and sometimes athletes say they have asthma, but they're using their albuterol to increase their muscle energy and muscle growth. So they're using it as a steroid. Ergogenic drugs include anabolic steroids, stimulants, human growth hormone, pre-steroids, beta blockers, and erythropoietin. Ergogenic techniques include blood doping, soda doping, herbal medicines, and weight loss. Anabolic steroids are synthetic androgens and are used for muscle building and muscle repair. Let's go ahead and do that again. That was better, I think. These drugs are used routinely in medicine to treat testosterone insufficiency, delayed puberty, wasting diseases, osteoporosis, certain types of anemia, some breast cancers, and endometriosis. Your endometrium, if you're female, you have an endometrium. It is the lining of your uterus, and what causes your periods is the sloughing off of the endometrium. My sister died of endometrial cancer. What happened was she was having a hysterectomy, and they left a piece of endometrium in her abdominal cavity, and it grew. It became a cancer. It had nothing to do, and it was healthy tissue, so it just became a cancer, and it eventually killed her. It got into her liver and developed endometrial liver cancer, as weird as that sounds. When athletes take steroids, they experience increased body weight, lean muscle mass, muscular strength, stamina, aggressiveness, and confidence. Athletes taking anabolic steroids will take 20 to 200 times the prescribed daily dosage in order to be big. Anabolic steroid users will use the drugs in from 4 to 18-week cycles. This is done to give the body a chance to recover from the drug use or to escape detection of use. Cycling steroids usually involves using more than one kind of drug. 82% of cyclers cycle 3 or more different steroids at a time. 30% use 7 or more steroids. This is how crazy it is. And it's nuttier than you think because these people will die young. Immediate effects of steroid use is increased muscle mass and improved muscle tone. Having muscle too large and strong for the bone and tendon structure may cause an overstressing of the muscle. And this is one of the ways that we can tell if somebody is a steroid user. A lot of times they will rip their muscle away from their bone. They'll rupture their tendons, they'll damage their ligaments, and they'll rip muscle away from bone. So anytime we hear about that happening, we don't know for sure, but we have a pretty good inkling that this individual has been on steroids, and now they've damaged themselves. And of course, the only way to repair muscle torn away from bone is with surgery. Users often complain of feeling bloated. It's because they are retaining water. The reality is when you lift weights and you look at yourself in the mirror after lifting weights, what you're really seeing is water buildup in your muscles. That's why you look so buff. It's water weight. It's water. In order, oh geez, bodybuilders when they go to competitions, one of the things they have to do is they have to suck the water out of their bodies. So they'll take diuretics, and the diuretics will reduce the water around their muscles, so their muscles look larger. Anabolic steroids suppress the natural production of testosterone. Yeah, think of it this way: anabolic steroids are artificial androgens. Androgens, of course, one of the major androgens is testosterone. So since your body is producing testosterone, since your body, if you're a male or female, you're producing testosterone. So if you're putting superficial testosterone in your system, your body doesn't have to make testosterone anymore. And that's one of the reasons why they were cycling. One of the ways that you get your body to start producing testosterone again is to take estrogen. Estrogen is the female hormone. There was who was the guy that was caught using estrogen? It was Manny Ramirez, the baseball player Manny Ramirez. He wasn't caught with steroids in his system. He was caught with excessive amounts of estrogen in his system. Oh, somebody else was Melky Cabrera, was caught with excessive amounts of estrogen in his system, not steroids. He had female hormones. Anabolic steroids will cause enlarged breasts, nipple changes, decreased size of sexual organs. This is a shrinkage of the penis and the testicles, impaired sexual functioning because you have shrunk your testicles and your penis, cystic acne growth. This happens especially on people's backs. So if you look at somebody's back and they've got just tons of acne back there, and it's caused cysts, then you can be pretty sure that they are using steroids. Thinning hair and more rapid balding. This gets really weird because back in the 70s and 80s, we had two basketball players that just went bald all of a sudden. One of them was Charles Barkley, and the other was Michael Jordan. And I've always wondered if those two individuals were using steroids, and that's why they went bald so fast. They were relatively young, in their 20s or 30s, and here all of a sudden they started shaving their heads. It's kind of a giveaway, the rapid balding. And that's what somebody looks like when they're on steroids. He still has hair. I'm guessing that's his hair. But as you can see, he's on steroids. He's got really good striation. You know, I was telling you about sucking all the water out of your system so that you can see the muscles. He's in a competition, and that's one of the reasons why he looks so ripped, is because he doesn't have any water surrounding his muscles, so you can see them. Female athletes also use anabolic steroids. Not the smartest thing in the world. Anabolic steroids, of course, are male hormones, and they use it, of course, for muscle growth and other masculinizing effects. Though some are unwanted, they have increased facial hair, decreased breast size, lowered voices, so they sound like boys, clitoral enlargements, cystic acne growth, of course, is mostly in their back, and thinning hair, which most women don't want their hair to go away. They don't want to be bald, so they have to shave. Most of these masculinizing effects are irreversible. Once it starts, it is there forever, and there's nothing that they can do about it. There's a lady that's on steroids. As you can see, she looked a little bit more feminine on the left than she does on the right. Another lady on steroids, big deltoid muscles. Anyway, I don't know, she didn't have much breast to begin with, and now she looks like she's a boy. She looks more like a boy than she looks like a girl. Here's a lady, I don't know, she looks more anorexic than anything. And there's another one. I would think she looks fairly feminine on the left in 2005, and she looks pretty ripped on the right. She looks kind of masculine, doesn't she? She certainly has big latissimus dorsi. And this lady was a model. She was in good physical condition, and then she decided she wanted to be a bodybuilder, I guess. And you can see she's done a good job of being a bodybuilder, but she certainly doesn't look very feminine. She looks more masculine. The right side, you can see that she doesn't have very much hair. It looks like she's got hair loss going on. Anabolic steroids increase the cholesterol of the user, especially the bad cholesterol, the LDL. At the same time, steroid lowers the good cholesterol, or HDL. Steroid users have an uncommon amount of cardiovascular problems, hypertension, thrombosis, cardiomyopathy. Cardiomyopathy is heart muscle problems. Because steroids encourage cell growth, they may equally encourage cancer cell growth. And this is one thing that tends to happen to people who are on steroids. They're very susceptible to cancers. Steroids mess up your kidneys, they mess up your liver, and a lot of these individuals die of liver or kidney cancer. A lot of them die of brain tumors. Anabolic steroids do have an impact on the user's mental state, at first supporting more aggressive and confident behavior. As use continues, confidence swings to aggressiveness, to emotional instability, to rage, to hypomania, to depression, to psychotic symptoms, to paranoia. This emotional cycling is known as roid rage and is more pronounced in individuals who have anger issues. There was a lineman from the University of Nebraska. He was at a bar. He was actually at my daughter's. My daughter was working in that bar at the time, and this guy suddenly started ripping his clothes off. I'm not talking about taking his clothes off. This guy was tearing his shirt off. He was tearing his pants off. Stripped himself naked in the bar, and of course people were trying to stop him, but he was this huge physical specimen, and nobody could handle him. Went running out of the bar, ran into a residential area, buck naked, running down the street. There was a lady jogging with her dog that was coming toward him. She was almost at her house. He got there just as she got there. He grabbed a hold of her. He tore her clothes off. He shoved her through the window of a car. The dog was barking. He grabbed the dog. He killed the dog. He started to take the lady inside her house, busted down her door. About that time, the cops got there. It's another naked story. The last naked story I told was a PCP story, uh, but it was the same kind of a situation. He he never got he entered a mental hospital, and my daughter was she was a freshman at the time. She graduated a couple years later. He's still in the mental hospital, but they were trying to hide the fact that he was on steroids because at the time, of course, Nebraska was they were national champions, and they weren't supposedly using steroids, but they were using steroids, and that was a problem. While people report a slight euphoria when taking anabolic steroids, it is thought by researchers that this is due to the anticipation of intense activity rather than actual addiction. While some users do report withdrawal symptoms, and in fact, some users will use low doses during cycling to maintain their sanity. There is some animal study evidence that steroid use is addictive, but it's mostly anecdotal, unfortunately. Stimulants are taken by athletes to make them more alert, to make them feel more confident, and to make them stronger. Much of the increase in ability when taking amphetamines is increased focus and aggressiveness. Heavy usage can lead to blood pressure problems, exhaustion, and malnutrition. And that's a taking of stimulants. They had a really serious problem with amphetamines in baseball back in the 80s. They started using, of course, in the 60s and 70s, or the drug era, when we had all the people smoking pot. We had the hippies smoking pot. We had a large percentage of people in the United States doing drugs. The 80s were the amphetamine years, and this was the year. These were the years that people were using amphetamines. If you were a hitter and you knew your pitcher was, well, of course he was taking something, then you wanted to take something too to countermand that. It was better for the pitchers than it was for the hitters. And so for the 80s era, there was lower batting averages, fewer home runs were hit, and of course they neutralized the amphetamines that the pitchers were taking by the hitters taking steroids. And of course, every time somebody gets an advantage, then the other guy needs to get some kind of an advantage. They actually lowered the pitcher's mound during the era when they had all that pitcher domination. And the reason they had pitcher domination, of course, we know this now, was because they were using amphetamines. And so, because they were all hopped up on amphetamines, it doesn't help you hit, but it does help you pitch. And of course, that's what was going on. They were a lot more aggressive because they were taking the amphetamines. Caffeine is a mild stimulant used by some athletes. At low doses, it increases your wakefulness, your mental alertness, slightly increases your endurance, and it increases your muscle contraction, digestive disturbances, and urine output causing dehydration, and that is caffeine. Ephedra or mahuang and ephedrine are mild stimulants used by some athletes. These substances are found in many over-the-counter medicines. Not everyone is sensitive to these medications, but to those who are, they cause jitteriness, anxiety, headaches, high blood pressure, cardiac arrhythmia, poor digestion, and overheating. There was a baseball player that actually died on the baseball field from a ephedra overdose back in the 80s. Chewing tobacco used to be a mainstay in Major League Baseball parks. From the beginning of baseball until into the 1980s, many, if not most, baseball players maintained a chaw of tobacco in their cheeks almost constantly during a game. I can remember when I would go to Major League Baseball games in the 50s and 60s, just about everybody chewed tobacco. Almost everybody chewed tobacco, especially the pitchers. Many baseball icons of the past died of throat or esophageal cancer. It is rarely seen today. This is a picture of Nellie Fox. He died of esophageal cancer. This is Pablo Sandoval on the right. He plays for the Giants again. He was playing for Boston there for a while. But as you can see, he's got a snuff dip of snuff in his cheek. I was trying to find a good picture of Tony Gwynn. Tony Gwynn died at 54 of cancer. He dipped snuff all of his baseball career. I tried to find a good picture of. He had such chubby cheeks. It was difficult to see what was in there. But Tony Gwynn died at 54. Sadly enough, Hall of Fame baseball player, fabulous baseball player for the San Diego Padres, died at 54 of, he had cancer in his mouth. And of course, he claimed that it was because of all the tobacco that he chewed. And his family actually sued the tobacco companies for his death. But he had cancer in his mouth, and that's why he died. In 2014. Human growth hormone is a hormone produced by the pituitary gland to stimulate growth in children. It is prescribed for children who are of unusually small stature to stimulate growth, and for people with wasting diseases like AIDS to build strength. It is used by athletes because it increases their muscle mass, their skin thickness, connective tissues and muscles, acromegaly, cardiovascular disease, decreased sexual desire, goiter, menstrual disorders and impotence. It decreases lifespan by up to 20 years. So here we have this growth hormone. Will you use it? Will you not use it? Ryan Braun was found with growth hormone in his system the year that he won the most valuable player in baseball. He plays for the Milwaukee Brewers. That's what acromegaly looks like. Acromegaly is a lengthening of the face and chin. People with acromegaly have small ears, as weird as that may seem. So if you see somebody like this, they're suffering from acromegaly. Androstenedione, andro and dehydroepiandrosterone, or DHEA, are natural hormone precursors to testosterone. Neither of these supplements have been found to do more than increase testosterone levels in men with abnormally low testosterone. However, if you have normal testosterone and you take either of these drugs, it does not raise your testosterone level. They also seem to increase HDLs and female hormone estradiol, which means the more of this stuff that you take, the more female hormone you have. Beta blockers are medications prescribed to lower your blood pressure, to decrease your heart rate, to prevent arrhythmias, to reduce eye pressure. They work by blocking adrenaline from exciting the heart. They also calm the individual by blocking nerve cells in the brain. Beta blockers are used by athletes who require precision and concentration, such as archers, participants in rifle shooting competitions, ski jumpers, and divers. Beta blockers do have their problems as they cause fatigue, lethargy, dangerously low blood pressure, gastritis, occasional nausea, vomiting, temporary impotence. They may intensify asthma, and they intensify heart problems that may kill the user, of course. Erythropoietin, or EPO, is a medication that is given to individuals to promote red blood cell production. It is often given to individuals who are going through chemotherapy to induce their bone marrow to produce replacement RBCs due to their problem, which is going through chemotherapy. EPO is used by athletes to increase stamina, though this unnatural thickening of the blood can lead to blood clots, which in turn might lead to strokes or heart attacks. When my sister was being treated for her cancer, she was given chemotherapy. It was really kind of amazing. My sister was only supposed to live for about 6 months, and she lived for about 4 years with the cancer. So she's a pretty tough lady. But she went through hell, I'll tell you. It was pretty bad. One of the things she did was when she was in chemotherapy, she became anemic. And of course, in order to increase her red blood cell production, they would give her erythropoietin. And that would all of a sudden she'd have all this energy and whatnot. Whereas before she looked like somebody just washed out her red blood cells with Clorox or something. She was pale as a ghost, and she had no energy. But then they'd give her EPO, and she was fine, or well, she was as fine as she could be, I guess. A similar problem is blood doping, where the athlete stores their own blood prior to competition, and then they are administered the packed red blood cells to increase the stamina of the individual. This happens a lot in cycling. It's used in the other endurance sports, especially in cycling. This is something that they check for in the Tour de France, in all this professional bicycling stuff. You hear that they cheat so much in bicycling. Lance Armstrong, of course, was this great hero, had won the Tour de France 7 times. He lost all of his medals. They took them all away from him and gave them to the second place finisher because he cheated. He was cheating in one way or another. There were French newspapermen that were on top of the whole thing. They tried to get the Cycling Federation to look at their evidence against Lance Armstrong, but they were unsuccessful until eventually it was fairly obvious what was going on. Athletes will use just about any substance that will give them a competitive edge. They'll use herbs, animal extracts, vitamins, minerals, proteins, anything. Unfortunately, some of these items may contain banned chemicals and cause the athlete a great deal of trouble because then they become banned by the sport. One dietary supplement used by athletes is creatine. Creatine is an amino acid that occurs naturally in the human body as well as in fish and meats. Creatine is used because it delays muscle fatigue. It stores energy that can be used in short bursts. It extends the amount of time a person can work out. It helps muscles recover faster. Problems come when it is overused, causes dehydration, stomach cramps, nausea and diarrhea, muscle pulls and strains, and kidney problems, which the kidney problems are caused by the dehydration. Gamma hydroxybutyrate, GHB, was used in the 1980s and early 1990s as a fat burner, as an anabolic agent, sleep aid, muscle definer, plant growth supplement, and psychedelic. It was picked up by sexual predators as a date rape drug. It is now only used legally as medication for muscle weakness. So that's the only way you can get GHB is if you have a wasting disease that is causing muscle weakness. Some athletes will consume sodium bicarbonate 30 minutes prior to exercising to decrease the development of acidosis. This works for shorter events that take place within 10 minutes, but not for longer endurance events. It can cause diarrhea and water retention, which is not a lot of fun. Athletes trying to make weight will resort to various techniques to drop unwanted pounds. Diuretics, laxatives, exercise, fasting, self-induced vomiting, excessive sweating in the sauna, and stimulants. Some athletes will lose 3 to 5% of their body weight in a couple of days. This happens especially with wrestlers. Not a good idea because, of course, they feel drained after all this happens. Anorexia and bulimia are not uncommon among athletes who are potentially trying to make unrealistic weight levels. Another problem with weight maintenance is the opposite of anorexia, muscle dysmorphia, where the individual becomes obsessed with muscle development as they see themselves as too weak whenever they look in the mirror. These individuals are more likely to take copious supplements and steroids to combat their body's weaknesses. And of course, they don't have a weakness. They just feel like they do. Athletes will often use diuretics to lose weight rapidly, to limit the bloating caused by steroids, by sucking the water out of their system to avoid detection of illegal drugs, to lose weight to look thinner. Athletes need to monitor their use of diuretics because of the possibility of dehydration leading to heat stroke and organ damage. Weightlifters will take adrenaline supplements combined with amyl or isobutyl nitrite to increase strength. It unfortunately can cause dizziness, rapid heartbeat, hypertension. Bee pollen is sometimes taken as a supplement, a way of boosting energy levels, digestion, and reduce stress. Studies do not support any of the benefits of bee pollen. It is a myth. Some athletes will take calcium pangamate as a supplement. This chemical combination is sometimes referred to as vitamin B15 and pangamic acid. It is refuted to keep muscle tissue better oxygenated, though there is no scientific research to back up this claim. This substance is known as a carcinogen. Periactin is reputed to be a steroid-like bodybuilder and has been used to increase body weight and muscle strength. This drug is an antihistamine. It acts as a serotonin and histamine antagonist, and it increases muscle mass and strength by making the individual hungry, so they eat. It actually merely increases the user's appetite and has the added side effect of decreased performance, sweating, and sedation. Drabapoetin is a medication developed to treat chronic anemia. We talked about erythropoietin before. This is darbepoetin. Just like erythropoietin, the drug increases RBCs and thus the oxygen carrying capacity of the athlete's blood. Human chorionic gonadotropin is a substance produced by fetuses to protect themselves from their mother's immune system. HCG, along with clomiphene or tamoxifen, is taken by steroid users to restart their own body's testosterone production. This substance also blocks the increased effects of estrogen in the male body. The drug can have an impact on the liver and, of course, on the reproductive system. Provigil acts as a stimulant and is used to treat narcolepsy. Athletes using the steroid THG will take this drug to mask the steroid. Orethine and arginine are amino acids taken to increase muscle mass because it is reputed that they cause an abnormal release of HGH, human growth hormone. Remember, if you take human growth hormone, you can reduce your life expectancy by 20 years. Primogen is used in Europe to facilitate the release of steroids in the body. Vitamin B12 is used to ward off illnesses and provide extra energy. It can also be used to speed the recovery from a hangover. Vitamin B12 is red. I used to give vitamin B12 shots to people all the time, not because they had a hangover, but to give them energy. As has been seen, athletes will do just about anything and take just about anything to improve their performance on the athletic field. Athletes will use stimulants to boost their performance, from innocuous caffeine and tobacco to the more destructive amphetamines. Athletes will use sedative hypnotics, especially Xanax, to unwind from the stresses of competition. Sometimes these drugs are used to counteract the stimulants that they have taken to perform. The most widely used depressant by athletes is alcohol. While in low doses the substance does not hinder performance, in most cases alcohol is used as a reward for performance, as a way to unwind, or as a consolation after a disappointment. Marijuana is contraindicated for performance, though when used in the right mood might actually improve performance. Marijuana doesn't help athletes because it lowers your blood pressure, causing fainting during competition, inhibits sweating, which might lead to heat prostration during exercise, decreasing tracking ability, hinders the ability to do complex tasks. It diminishes hand-eye coordination. It decreases oxygen intake. It is banned substance by the NCAA. It is illegal in 39 of 50 states. Illinois has now legalized marijuana. Because marijuana is fat soluble, it continues to impair 1 to 2 days after you use it. Okay, why don't we stop right here? I've talked long enough. This is good enough. This is the 26th. So see you later. Have a good day. If I can figure out how to turn this thing off. There we go. Okay.